Hi, I'm Dr. Abe. I'm an MD and cannabis health coach, and I'm here today to answer your questions about THCA and how it affects your body. THCA is a natural and non-intoxicating cannabinoid that grows in most cannabis plants. It's different from THCA in that it won't get you high, and it's found in some legal hemp products. You can think about THCA as the last stop on the cannabis train before you get to THC. If you want to get THC-like benefits without the high, this is your closest stop. There are some people who still want psychoactive effects, but aren't allowed to ride the cannabis train straight to THC. In that case, you can still get there fast from THCA just by vaping, smoking, dabbing, or otherwise adding heat to THCA products. THCA is best known for potentially relieving inflammation, chronic pain, nausea, and vomiting. Limited research suggests it could be a good add-on to enhance CBD for these conditions, as well as for conditions like inflammatory bowel disease, neurodegenerative conditions like Huntington's, cancer, muscle spasms, and seizures. Pure THCA is actually non-impairing, so it doesn't cause a high or sleepiness like THC does. If you want to get stronger sleep-inducing effects, you could heat up THCA into THC or combine it with other cannabinoids like CBD or CBN. Pure THCA won't feel so different from taking CBD or other non-impairing cannabinoids. Some of my patients who live in states like South Carolina or Iowa, where cannabis isn't legal yet, use THCA for relieving joint pain right before their morning jog around the neighborhood, for getting relief at work, or dealing with everyday anxieties like going to college or socializing. At home, some of them will choose to heat or decarb it first to activate the full set of psychoactive effects and benefits of THC. THCA is the reason you can't actually get high from eating or juicing raw cannabis leaves. If you take a THCA tincture or gummy, it shouldn't feel any different from taking your CBD oil. Just remember that adding heat changes THCA into psychoactive THC. It takes you to the next stop on the cannabis train. So if you vape a THCA cartridge, dab THCA diamonds, or smoke, vape, or bake THCA hemp flower, then those heated methods can get you high from the newly formed THC. So there isn't a lot of direct research on the safety of THCA, but so far it shows similar side effects to CBD. Side effects of THCA are uncommon, relatively mild, and usually fade away on their own within a few hours. If you use THCA in its raw form, like in a tincture, you could feel sleepy and tired. You might even notice that you're not as hungry as usual, and that's because THCA can also affect your appetite. The most common side effect I hear my patients talking about is that it makes them drowsy, and so they like to take it right before bed so it helps them fall asleep. If you need to take THCA throughout the day for something like back or joint pain, you should remember that it may make you drowsy, but you can tweak your dosage as needed to strike the right balance. THCA is generally safe, but it could increase the levels of various medications, including blood thinners, antidepressants, steroids, and anti-seizure drugs. It's unlikely, though, to have a significant reaction outside of anti-seizure drugs. If you're taking these meds or have specific health concerns, you should ask your doctor first before taking THCA. THCA is a reasonable substitute recommendation where Delta-9 THC isn't available yet. For instance, my patient in South Carolina uses THCA hemp flower to manage his arthritis pain, and his inhaled dosing is basically the same as THC. Meanwhile, raw preparations like tinctures and edibles are dosed just like taking CBD. You can even take equal amounts of CBD and THCA to maximize their effectiveness. I would consider THCA for almost any adult patient with chronic pain, inflammatory disease, or seizure needs that can't be fully addressed with THC or CBD. THCA may be best as a complementary add-on to CBD in these cases. However, I would avoid THCA and THC in young patients or those who are pregnant or breastfeeding, since we don't know their effects on those populations yet. If you've used THCA, let us know about your experience in the comments. Or if you have any questions about THCA, write them in the comments section and I'll try to answer them or point you in the right direction. For more information on THCA, visit the link in the description.